All right, and so today we will be talking about the therapeutic agents for the musculoskeletal system. This is based on chapter 19 in the Mosby's Pharmacy Technician Principle and Practice book. In this chapter, the learning objectives include you being able to describe the major components of the musculoskeletal system. You should also be able to list the primary symptoms and conditions associated with the system, as well as recognize the drugs that's used to treat certain conditions that's associated with the musculoskeletal system, as well as be able to write the brand and generic names for the medications that will be discussed in this chapter. And lastly, be able to list the appropriate auxiliary labels when filling prescriptions for medications. So now that I've gone over the objectives, we are next going to get into the anatomy and physiology of the skeletal system. So what's so important about the skeletal system? Well, it provides structural support for the body. So inside of our skin, we have bones, which represents our skeletal system. So our skeletal system consists of muscles, tendons, ligaments, and bones. Now, with bone marrow, that represents where our blood cells are produced. So inside of the skeletal system, it also has the storage banks for minerals, minerals for the bones, including calcium and phosphorus, which are important in bodily functions. As we learn more about the anatomy and physiology of the skeletal system, we'll also begin to understand that there are two types of bone. We have compact and spongy. So the compact bone is also known as the cortical bone. It's very dense and it's located near the surface of the bones, and this is where it's the greatest need for strength. Now, the spongy bone, on the other hand, it's typically located on the inner part of the bones and is composed of a network of thin strands of bones that are also known as trabeculæ. So when it comes to the spongy bones, it's sometimes called the cancellous bone or cancellous bone. And you can refer to figures 19.1 and 19.3 in your book. So continuing learning more about the anatomy and physiology of the skeletal muscle, you need to know and understand that there are three types of muscles. There are the skeletal muscles, the cardiac muscle, and the smooth muscles. And all of these types of muscles attach to the bones to aid in movement. And each muscle contains a muscle fiber. And so the although each muscle is composed of fibers, those are grouped in bundles called fascicles. So in understanding that the body has three main types of muscle, we'll continue learning more about the anatomy and physiology of the skeletal muscle. So we talk about the groups of fascicles, and those would include myofibrils, actin, and myosin filaments. Inside of our bones, we have some signals that causes our muscles to contract. And then we also have the motor nerves, which carry signals from the central nervous system, which its abbreviation is CNS. And the motor nerves also carry signals to the skeletal muscles, including in the physiology and anatomy of the skeletal muscle. You also have the neuromuscular junction, and the neuromuscular junction is the point where a motor neuron meets and signals the skeletal muscle. And so now that we talked a little bit about the anatomy and physiology of the skeletal muscle, we'll next get into some conditions that affect the skeletal system. One of the conditions that affect the skeletal system would include osteoarthritis, and osteoarthritis is the common form of joint disease. Osteoarthritis has an abbreviation, and it is OA, and it's basically a degeneration of joint cartilage and the underlying bone. So when a person experiences osteoarthritis, they have a loss of normal cushioning, and so when that affects their skeletal system, it affects their knees, their hips, their spine, their hands, and their feet. Now, unfortunately, there is no cure for osteoarthritis. So when patients are diagnosed with this condition, they would have medications to help with the symptoms. And although there is no cure for osteoarthritis, the disease, slowing the disease is possible. So there are some medications, as I mentioned before, there are some medications that are used to maintain the quality of life, and it's going to also help control the pain. So we learned that osteoarthritis is a common form of joint disease. Next, we're going to learn about some of the treatment for osteoarthritis. So some of the treatment that a person might receive if they are diagnosed with this condition would include occupational and physical therapy. They might have to do some regular exercise as well as do some weight loss because it's a lot of pressure on the bones. So some of the medications, especially when it comes to drug classes that might assist with treatment for osteoarthritis, would include analgesics and antipyretics. Analgesic is a pain medication. So one of the common pain medications that's used for the treatment of osteoarthritis would include acetaminophen, and the abbreviation for acetaminophen is APAP or APAP. Other drug classes that would assist with the treatment of osteoarthritis would include NSAIDs, NSAID, which is an anti-inflammatory drug class. NSAIDs stands for non-steroidal anti-inflammatory drugs. So when it comes to drug classes, you have some drugs that are steroids that can assist with inflammation, and then you have some drugs that are non-steroids that can still help with inflammation. So we talked about NSAIDs, and then the other drug class that would help would be steroid injections. And so although acetaminophen and NSAIDs and even opioid analgesics can be used for a variety of pain conditions, they are discussed in detail here largely in the context of the treatment of osteoarthritis. So a patient can be on opioids to help with the pain, NSAIDs to help with the pain and inflammation, or be given acetaminophen to assist also with the pain. So now that we talked about a few of the drug classes that's going to help with the treatment of osteoarthritis, let's next get into a better understanding of what acetaminophen is. So acetaminophen is both an analgesic and an antipyretic. You need to know analgesic means it's for pain, antipyretic means it's a fever reducer. So that means acetaminophen has two main properties. It's a pain reliever and a fever reducer. The NSAID and SAID, NSAID has three properties, and I'll kind of get into that when we get to that particular slide. Now with acetaminophen, remember acetaminophen's abbreviation is APAP. So if you ever see that written on a prescription, that's what the physician, or should I say prescriber, is referring to. Acetaminophen can also be in combination with some medications, so you might see that as well. With acetaminophen, it does not have peripheral anti-inflammatory or inhibitor effects on the platelet function. What does that mean? When a patient takes an NSAID, more than likely they have to take it with food so that it does not mess up the inner lining of the stomach. With acetaminophen, the patient doesn't have to worry about that. However, if the patient takes too much acetaminophen, there could be a cause of liver failure. So misuse of acetaminophen is the most common cause of liver failure. And so when it comes to patients misusing the acetaminophen, they might be just taking too much because they're in pain, but they have to be cautious and take it as directed, because most cases of misuse are actually unintentional. So when a person's in pain, they're really just trying to get out of the pain, but it's important that they take it as directed because there are some negative factors. Now, acetaminophen is widely considered the analgesic of choice for osteoarthritis, largely because when compared with NSAIDs, acetaminophen has fewer hematologic and GI ulcers and renal effects. So that means the acetaminophen is not going to mess with the platelets, meaning it's not going to thin the blood or cause ulcers in the stomach, because it's not going to mess up the inner lining of the intestine, and it's not going to have negative effects to the kidneys. However, it's really important that it's taken as directed because it can affect the liver. So now that we've talked about acetaminophen, we are next going to talk about aspirin. And with aspirin, aspirin was actually discovered by aspirin was actually discovered from the bark of a willow tree, and it was marketed by Bayer in 1899. You should know the abbreviation for aspirin is ASA, and that's mainly because it represents the chemical element, which aspirin's chemical element is acetylsalicylic acid. So that's where the ASA comes from. Now, when a person takes aspirin, it's known to help treat pain, fever, and inflammation. It's very, very, very important to know aspirin should not be given to children. The reason why it should not be given to children is because Ray's syndrome would be associated with that effect. And so with Ray's syndrome, which you might be wondering what that represents, it might be pronounced Rye, so Ray or Rye, either or. This particular condition may develop after a chickenpox or an upper respiratory tract viral infection. So a person with Ray's syndrome may cause vomiting, lethargy, and other effects that can lead to a coma or death. So aspirin should not be given to children. Now, when a person takes aspirin, it's also important to know they should not exceed a maximum dose of 4 grams per day. So the maximum dose for adults is 4 grams per day. And the common side effect of aspirin is an upset stomach. So patients should also be careful when taking this medicine. So it's encouraged that they also eat something before taking this medication. Aspirin is also known to be the prototype for NSAID. So a prototype means it acts similar to an NSAID. So aspirin is the prototype for NSAID. And it's also important to understand aspirin works by thinning the platelets, by thinning the blood. So patients who are on blood thinners should be very cautious and only take aspirin if directed by their doctor, if they're already taking an anticoagulant, which works as a blood thinner. So that's something that's need to know. So now that we've learned about aspirin, we'll next continue to learn more about NSAIDs. NSAIDs representing non-steroidal anti-inflammatory drugs. Again, the prototype of an NSAID is aspirin because the structure is close to it. You have other types of medicines that's under the NSAID umbrella. And one example of that would be COX enzyme. So the COX enzyme works by suppressing the inflammation by exhibiting the cyclooxygenase enzyme. And so when it comes to the COX enzyme, you have COX-1 and COX-2. COX-1 enzymes promote platelet aggregation and metabolic function, whereas COX-2 works by being at the site of the tissue injury. So the NSAIDs suppress the inflammation, and it could also be used for mild to moderate pain. They also have an antipyretic function, which, remember, antipyretic means fever reducing. So with the NSAID, an NSAID has 3 properties. I told you that acetaminophen has 2 properties. The 2 properties of the acetaminophen is it is a pain reliever and a fever reducer. The NSAID has 3 properties because it's a pain reliever, it's a fever reducer, and it works for inflammation. So based on the effects of the patient, that is why NSAID may be chosen. Now that we've learned about the drug class NSAID, we'll next learn about some common NSAIDs. So some common NSAIDs are naproxen, meloxicam, and ibuprofen. A lot of people know ibuprofen as being over the counter. The brand name of ibuprofen, it has two brand names. It's either Motrin, or I believe it's Aleve. Ibuprofen and Aleve. Excuse me, Motrin and Aleve are the brand names for ibuprofen. For meloxicam, the brand name of that drug is Mobic. And for naproxen, the brand name of that drug is actually naproxen, which it sounds just the same, but the ending is spelled differently. When NSAIDs are taken, it should be taken with food to avoid stomach irritation. As I mentioned before, it's important to take it with food, because if not, then it's going to hurt the lining of the stomach. I want to make a correction with the ibuprofen. It's Advil. Oftentimes, people got to make sure that they're saying the right one. So you have Advil and you have Aleve. Advil and Motrin's generic is ibuprofen, and then Aleve is actually the over-the-counter brand of naproxen, and naproxen, Naprosyn, is the brand prescription of naproxen. So when it comes to NSAIDs, you have some that's available over the counter, and you have some that's available by prescription. So also need to know, for ibuprofen, the generic, it's available over the counter as 200 milligrams. However, by prescription, it's available in 400 milligrams, 600 milligrams, and 800 milligrams. So now that I've given you some information about the common NSAIDs, I next want to talk to you about the COX-2 inhibitors. And so I told you earlier that there are two forms of the COX inhibitors. You have COX-1 and COX-2. With COX-1, the side effects of that particular medication is that it could cause gastric ulceration. So there could be ulcers in the stomach, bleeding, and also renal damage. Anytime you hear renal damage, that represents the kidneys. Now with COX-2 inhibitors, those do not reduce the NSAID side effects. And so the theory behind COX-2 selective inhibitors is that they could treat pain and inflammation without the risk of the non-selective agents that also inhibit the COX-1. So the common COX-2 inhibitor medication is called Celebrex. You may have heard the commercials where the people kind of saying, Celebrex, Celebrex, come on to Celebrex. I don't know, but that's how I remember it. So with Celebrex, its generic is Celecoxib, which you'll get more familiar with as you continue to learn about the top 200 medications. Now with Celebrex, it also works with treating osteoarthritis as well as rheumatoid arthritis. So now that I've gone over the NSAIDs, the aspirin, the COX-2 inhibitors, as well as the acetaminophen, we're next going to talk about some topical over-the-counter pain relievers. And so topical represents anything that's going to be applied to the skin. So topical over-the-counter pain medications can help manage osteoarthritis as well as help manage muscle strains. So patients widely use certain products that contain some of the following ingredients that would include menthol and methyl salicylate. An example of the menthol and methyl salicylate would be Bengay or Icy Hot. I have personally used Icy Hot and it works wonders. That is not me at all recommending or counseling. I'm just saying what it has done for me and in my life. The next topical over-the-counter pain reliever would be trolamine salicylate, excuse me. And its brand is Aspirin. You may see that available over the counter. And then another over-the-counter pain reliever would be the Tiger Balm, which its main ingredient is camphor plus menthol. And I can really make a testimonial about Tiger Balm. It's very potent in smell, but it works. and sometimes really, really fast. Now, when patients are using topical over-the-counter pain relievers, it's important that they should only use the product on intact skin. So if there is a type of injury in like a open wound or something, that's not really going to be good. So always remember, for patients who have questions in regards to what is the best over-the-counter pain reliever and which one should they use, that's a counseling question, and that should definitely be directed towards the pharmacist. So now that I've talked about some of the topical over-the-counter pain relievers, we're next going to talk about opioid analgesics. And so with opioid analgesics, you should know these are controlled substances. And so majority of them are under the Schedule 2 of the controlled substances because they're narcotics. Some of the controlled substances might cause sedation and also respiratory depression. Now, the mechanism of action for opioid analgesics is that the opioids act on the analgesics act on the opioid receptors in the brain. And so it changes the perception of the pain at the CNS and the spinal cord level. So for the one of the most common, or should I say, the prototypical opioid agent is actually morphine. And so morphine is available in an oral form as well as an injection form. So there are different types of medication forms that the opioid analgesics can come in. They can also come in patches. An example of a opioid analgesic patch would be fentanyl, Duragesic. And so the three main types of opioid receptors in the brain are mu, kappa, and delta opioid receptors. And so when it comes to the opioid analgesics, the reason why they are under a Schedule 2 controlled substance is because they're the most highest form of abuse. So if a person overdoses on it, it's potentially life-threatening. And so there are certain rules associated when a prescriber even prescribes a opioid analgesic. And you'll learn more and more about that as you continue in your pharmacy technician education. So now that we've learned some of the conditions and some of the drug treatments that would help with osteoarthritis, let's next learn about another condition, which is osteoporosis. So we learned with osteoarthritis that it is a disease that affects the joints. Osteoporosis is a systemic skeletal disease. So it has low bone mass and the bone would actually deteriorate. It's also a danger in the bone fracture because when your bones become fragile, remember your bones are connected to other things. And so when the bones become fragile, it's a person may be more susceptible to falls. Osteoporosis actually affects women who have gone through menopause. So it affects postmenopausal women. And so now that we've learned about osteoporosis, we'll next learn about some of the management and treatment in this condition. So with osteoporosis, it's the loss of calcium from the bones that results in the bones that become brittle and also fracture, or they can break easily. Now, the prevention of osteoporosis is it must be started early in life. And so some of the factors would be, life changes, a person having more exercise, more dieting, and if they're smoking, that person would need to have a smoking cessation, which is the medical term for quit smoking. And so some of the medications of choice would be, some of the lifestyle changes would be for them to exercise, and some of the things that they should be taking would be calcium and vitamin D, which would help with increasing the bone density. So according to the National Osteoporosis Foundation, approximately 10 million people have osteoporosis, and 34 million are estimated to have low bone mass, which can lead to osteoporosis. And so continuing to learn more about the management and treatment of this particular condition, In new studies, it shows that 15 minutes of direct sunlight twice weekly supplies enough vitamin D for the body. So if you are not going outside, getting some sun on you, getting some vitamin D, that really might be helpful. Multivitamins also act as a replacement for the sun if someone's not able to go outside. Um, for long-term use of corticosteroids, medroxyprogesterone, or excessive thyroid hormones, they also promote osteoporosis. And so an adequate intake of vitamin D and calcium are critical therapies because it's going to help in the assistance of the osteoporosis prevention and also some of the symptoms. So we learned about osteoarthritis, we learned about osteoporosis. Another condition that affects the skeletal system would be gout. So what is gout? Gout is arthritis that occurs when uric acid builds up in the blood. So think of gout as an how do I always usually say gout? Gout is where your body is has an overproduction of uric acid. And so uric acid is crystals in the joint, which can lead to inflammation and pain. Now, an acute attack of gout usually affects a single joint. And some of the treatment for if a person was diagnosed with gout would be for them to lose weight, for them abstaining from alcohol, because that actually makes inflammation in the body worse. They would be on a diet, so their red meat intake would need to be low. Red meat would be beef and lamb and even pork. So they would really need to have a low consumption of that. Now, some of the drug treatments that would help treat gout would have some therapies that include colchicine, NSAIDs, and corticosteroids. Now, 90% of patients with gout have trouble excreting the uric acid, and 10% are overproducers. So the prognosis for gout can be good if the contributing factors can be identified and if it can be resolved to prevent recurring gout attacks. So for more information on this, you can refer to figure 19.12 and 19.4 in your book. And so, as it mentioned, one of the main medications that's prescribed for gout would be a medication called colchicine. So as a pharmacy technician, you might see that written on a prescription, and now you'll know what that is for. And so one of the other things that I always like mentioning when it comes to patients, patients who might have gout, although it can affect a single joint, it can also have effects on multiple joints. And so with gout, it's also known to have some effects on the patient's toe. And so you can refer to figure 19.12 to see an example of that and what happens if a person has a real severe buildup of uric acid. And so we can't talk about the skeletal system without talking about skeletal muscle relaxers. And so that's what we'll actually be talking about next. So with skeletal muscle relaxants, those are used in injuries that's associated with the musculoskeletal system. It's used if a person has severe or chronic pain, and they may require more care. Now, some of the drug therapies for patients who need skeletal muscle relaxants might include a patient receiving analgesics, having muscle relaxers, as well as having physical therapy. So they'll be using all of those simultaneously. So for severe injuries, surgery may even be an option if the medications and physical therapy prove ineffective for treating the condition and maintaining quality of life and functionality. And so you can refer to table 19.5 to see more information on the skeletal muscle relaxants. Just for understanding, some of the common medications that's prescribed for muscle relaxers would be Soma, and Soma is actually a Schedule 4 drug. Its generic is carisoprodol. Another medication that's commonly prescribed for muscle relaxers would be Scalaxin, which its generic is metaxalone. And then one more muscle relaxant that's commonly prescribed for patients is Flexeril, and its generic is cyclobenzaprine. And so, in learning about the skeletal muscle relaxers, we will conclude chapter 19 talking about the neuromuscular blockers. And so, for the neuromuscular blockers, these are used with anesthetics and surgery. And so, these work by relaxing the skeletal muscles to induce paralysis. And so, there are two categories when it comes to the neuromuscular blockers. That would include depolarizing and non-depolarizing. With depolarizing, it mimics the acetylcholine, which its generic is ACH, and that's one of the main neurotransmitters. With another neuromuscular blocker, that would represent the non-depolarizing, which works by blocking the receptor activation as well as preventing transmission of impulses. So with neuromuscular blockers, they are used to help place the patient on a ventilator and also to suppress the patient's spontaneous breathing once a ventilator is in place. For the neuromuscular blockers, the type of neuromuscular blocker usually depends on the duration of the anesthesia that's required. And to see more information about this, you can see table 19.6 in your books. And that's going to conclude chapter 19, which is therapeutic agents for the musculoskeletal system.